Fancy seeing you guys again. You are here again with us, Azmina and Mahfuza. Assalamualaikum and a good afternoon I bid to judges, teachers, guests, and participants to the live streaming of the 9th Online Fully Residential Schools International Symposium 2021. Welcome back to our loyal spectators and hello to our new viewers. You want your own International Achievement e-certificate? You can get one by answering the online quiz that is given in the chat box below. If you manage to answer 80% of the questions correctly, you will be rewarded the e-certificate. The online quiz will be closed tomorrow at 10 a.m.
For the last time, let me reintroduce our honorable judges. We have with us Dr. Nur Anita C. Omar, the consultant ophthalmologist from Hospital Sultanah Nur Zahira as the chief judge. Then, the second judge is Mr. Muhammad Farhan bin Adnan from Sekolah Menengah Sains Hulu Terengganu. The third judge is Ms. Nur Azlina Mat Saad from the Malay College Kuala Kangsar. Ms. Azlina is not with us online today due to unforeseen circumstances, but don't worry because she will watch the YouTube live and award marks accordingly. Again, we are lucky to have you with us in this last session.
And we are back again, me, Nur Azmina Zamia Muhammad Nur Al-Azad, and my partner Mahfuza Andina Muzarmin, and we are the moderators in today's session and we are from Sekolah Seri Puteri. Again, the rules are, the presentation must focus on the sub-theme assigned to each theme. In this track, the sub-theme is Healthcare Innovations and Mental Health Anxiety Management during the pandemic. Next, the duration of the video presentation must not exceed 10 minutes. And lastly, a question and answer session will be conducted after each presentation. So, in this session, we are going to look at the presentations from the last 6 themes.
To not keep anyone waiting, let us start this session with Sekolah Menengah Sains Jeli to present their research video entitled Healthcare Innovations and Mental Health Anxiety Management During the Pandemic. Here with us this afternoon are Ahmad Ikwan bin Shabri and Batrisha Safiah binti Anwar. The stage is yours.
Typical teenager. I had this anxiety and stress of school, between school and extracurricular activity.
What are the definitions of healthcare innovations and mental health anxiety management? Healthcare innovations can be defined as a new improved idea in medical care, such as mRNA vaccine. Mental health anxiety management is the process of dealing with the feeling of nervousness in regard with psychological and emotional well-being. Next is our problem statement. The first problem statement is how far have the healthcare innovations have been improvised? Second, how effective is the mental health anxiety management among students? Other than that, we also have our objectives. The first objective is to identify the establishment of healthcare innovations. Second, to analyze how severe has the mental health anxiety affected the students in Malaysia. Besides objectives, we also have our significance of study. The first significance is, do students realize about healthcare innovations? Second, do students know that COVID-19 has brought an impetus on healthcare innovations? Third, do students realize that mental health anxiety is now becoming dominant? And the last one, are students well prepared with mental health anxiety management? We managed to gain some benefits. The first benefit is students can clarify with detail about healthcare. Second, students are able to develop innovative thinking. Third, students are aware of the mental health anxiety. And the last one, students are able to manage mental health anxiety. Ladies and gentlemen, in this research, we use two methods, which are questionnaire an internet-based method. The questionnaire was conducted to 100 respondents with different backgrounds. Students are chosen for this research because they are the future leaders, and to instill this knowledge in them is crucial. Second, which is internet-based method, where we use Twitter, Instagram, and Sina Harian to get along with the latest news. We have assembled the responses in this pie chart that consists of several races in Malaysia. We can see that 63% of them are Malay, 17% of them are Chinese, 14% are Indians, and the balance 6% belong to other races. I believe that all of you must be eager to know the results of our survey. We have separated the results into several pie charts. The first pie chart shows people who agree that COVID-19 has catalyzed innovation in healthcare. We can see that 72% of them agreed with this statement, while 28% of them disagreed. The second pie chart contains people who agree that Malaysia's healthcare is sufficient to fight COVID-19. Clearly, 63% of them voted for yes, while 37% of them voted for no. The third pie chart shows people who have experienced anxiety during this pandemic. Clearly, 71% of them admitted they have experienced anxiety, while 29% of them said they have never experienced anxiety during the pandemic. The last pie chart contains people who agree that anxiety is a major problem during this pandemic. In this view, we can see that 86% of them voted for yes, while 14% of them voted for no. We have prepared a bar chart that indicates the percentage of respondents against severity of anxiety. It happens that 29% of them faced zero anxiety, 90% of them encountered mild, while 33% of them encountered moderate anxiety, and the last 90% belong to the ones who faced severe anxiety.
Now, we have come to the healthcare innovations and how it improves current situation. First, mRNA vaccine. One of the main producers of this type of vaccine is Pfizer. For your information, 70% of the vaccines used for national COVID-19 immunization program is from Pfizer. This vaccine helps us to achieve herd immunity faster and also to reduce the death rate. Next is applications and devices. The application that we are using now is called as MySejahtera. This app gives you the latest information about COVID-19. The device that we are using now is oximeter, which measures the blood oxygen level in your body. This is very crucial for everyday use because low oxygen level in body may be linked with having COVID-19. With these applications and devices, we can be aware about COVID-19 more. The last one is over-the-counter rapid antigen test kit. This thing only needs your saliva or nasal mucus for it to detect whether you have COVID-19 or not. This thing is very easy and quick to use. So by having this, we can identify COVID-19 in early stage. Other than that, actions of decent mental health anxiety management and how it ameliorates mental health. First, set a routine. A psychology professor, Deborah Serrani, had said that unstructured schedules can lead to anxiety or depression. So, by having a structured daily routine, we can stop anxiety and depression from happening. Second, exercise and eat healthy. By exercising, we can improve our self-esteem and also our brain's cognitive function. By eating healthily, meaning that we increase the consumption of fruits and vegetables that contains vitamin C, it can also reduce anxiety. The last one is to stay connected with people, whether it's virtually or physically, just keep connected with people because it can help us manage stress and also avoid unhealthy coping mechanisms such as self-harm. Unfortunately, there are a few challenges we must face. First, solving inadequacy of healthcare equipment while advancing innovations. And second, disseminating mental health anxiety management knowledge to reduce mental illnesses induced during this pandemic. Luckily, we have proposed a few solutions. Firstly, is to promote targeted programs via media, and second, to tighten the budget for healthcare and organizations. By doing this, we can produce innovative and optimistic human capitals enhance health system, and also improve citizens' knowledge in managing mental health. There are a few programs that should be enlivened. First, Innovation World Cup Series Medica Startup Competition. This competition takes the connected medical innovation to an advanced level. Then, these innovations will later be used to ease the works in healthcare sector. Next, we have World Suicide Prevention Day or WSPD. This day inspires light and confidence into humans, and it also inculcates the solution to suicide by raising awareness about mental health. What's more, future plans must be done in order to get more accurate data. First, by expanding the area of research to adults. Second, observing the problems deeper. And lastly, to suggest a problem by connecting every aspect. As a conclusion, we have seen that COVID-19 has given biggest impacts in our daily life. From the bright side, we can see that COVID-19 has induced the need of innovation, that we are seeing many innovations being created. However, the fact that COVID-19 has worsened physical and mental health cannot be resisted. Last word from us, we hope that everyone can play their roles to manifest healthy citizens and better healthcare in future. That's all from our team. Thank you for watching.
Such an intriguing and informative research presentation, and I do agree with the slogan "Health is better than wealth." Now let's proceed with the question and answer session. The chat box is open to any questions that the audience may have.
So here's the first question from user Kalila. Why is it important for everyone to know a decent amount of knowledge about mental health, and how does someone with symptoms identify that they might actually have an illness? Can our presenters answer this question?
I would like to address this question. It is very crucial for everyone to have the knowledge about mental health, because if we did not, sorry, mental health is important for everyone because it could be happen to anyone, like one of our family members, one of our friends or siblings. So, and we have the decent amount of knowledge about mental health, we know how to cure, we know how to prevent, and we know what are the symptoms that the person is having. Other than that, someone can also identify with the symptoms that they might actually have an illness by maybe searching up at the internet, or maybe ask for ask from a professional like doctor, or maybe this physical education teacher at school.
Okay, thank you for the great feedback. Do we have any more? Okay. The second question is from user Siti Ashira Ismail. The question is, should we create an expert unit to protect the victims of mental health and anxiety patients during the pandemic? Can our presenters please clear the air?
Thank you for the question. So for me, it is it is an obligation for us to create and protect the victims of mental health and anxiety patients during the pandemic, because we know that these days during this pandemic, the mental health state is not like the normal days during the halcyon days before the pandemic has even started. So by having this expert unit, the mental health and anxiety patients during this pandemic can ameliorate their mental health and also know what to do so that they can improve their mental health. We know that now education is pressuring the students. That's why they are having the mental health and anxiety and mental health problems, and also they are scared of going outside because we have quarantine, and also they are not even indulging in with the people. So when they are not indulging with the people, they feel like they are lonely. And like have I said in the presentation earlier, that by staying connected with people can actually help to reduce the mental health anxiety among students. However, now we cannot do it. So by having the expert unit to protect the victims of mental health and anxiety patients during the pandemic, we can educate them about how to manage their mental health so that they doesn't face the anxiety that are going to harm them physically and mentally. Thank you.
I do agree with the response. Thank you very much.
Well then, can our judges please pose any questions or give any comments for our presenters?
Yeah, Assalamualaikum. Very good afternoon. Congratulations, Sekolah Science Jelly. Very good presentation. But I have some comments. Number one, usually problem statement is presented in a statement format rather than a question. What you presented is more likely to be research questions rather than a problem statement. Okay, that is a comment. Yeah. My question is, how do you utilize the findings of your research in conducting a program to promote good mental health well-being among the students in your school?
Okay, thank you for the question. So, in my opinion, for us to raise the funds so that we can help our students to raise their awareness about mental health and also help them to reduce the anxiety is by uh, is by taking donations from the families of the students, and also ask for money, request for money from the Ministry of Health. This is because it is very crucial that we should have a good mental health. And this is actually a very good way that we can actually pioneer the better mental health, because this would be the first school to ever do that. And then for me, the Ministry of Health would also put more uh, education for the schools to make sure that they are doing so that they can implement those programs
I'm very sorry
to
to
make sure
interrupt.
that the students are having no anxiety problems.
I'm very sorry to interrupt,
Okay,
but 5 minutes have
that's all
gone
from me.
by.
Thank you.
Thank you for the intriguing question and answer session, and thank you again to Sekolah Menengah Sains Jelly and of course our judges.
Thank you.
Now, to proceed further, let's welcome on board Team Sekolah Menengah Sains Sultan Mahmud with the presenters Nur Alisha Sofia binti Muhammad Salwadi and Muhammad Amar Afiq bin Nu'man to move on with their presentation with the title Students Battle Anxiety in Online Learning During COVID-19.
Coronavirus, or COVID-19, has given birth to a new way of life. We must face a series of obstacles, whether by hook or by crook, full with betrayal and apprehension, from physical health to social isolation. Our manner of life shifts to 360 degrees. People strive for a secure life, especially those who live in the outskirts and struggle to feed their families. Today's anxieties and tomorrow's unknowns with COVID-19, a new level of anxiety, hopelessness, and loneliness has been created, and that's what we are going to share with you.
Thank you, Amma, for the brilliant introduction. Now we want to talk about the background of the pandemic, the continuous outbreak of the respiratory sickness coronavirus disease 2019, which was just given the name COVID-19, is the most current threat to global health. COVID-19 was first identified in December 2019 and has since spread throughout China, originating in Wuhan according to Huan in 2020. The number of deaths continued to climb, forcing several countries to engage in social isolation and lockdown, prompting the World Health Organization to proclaim a pandemic on March 12, 2020. The COVID-19 has also put a stop to educational activities all around the world, according to Andrea Pogalapati in 2020. The epidemic also had an impact on educational institutions, resulting in a shift in how people learn. School and university are being forced to close as a result of its convenience. Online learning has grown significantly. You are probably wondering why I am bringing all of the issues about COVID-19, right? So all of the circumstances I have just stated give us a solid basis to investigate if students struggle with anxiety in online class during this pandemic. Let us now look at the challenge that student comfort was switching to a new learning style. Students must have access to technology as a main indicator of online learning preparedness. Some students do not own a computer, laptop, or even tablet. This device availability is a crucial aspect for the student to attend online class, according to G. Khalifa in 2020. According to the annual Walter, half of the students did not have access to a computer and 40% of it did not have internet access. In United States, about 7 million school-aged children are in home without home internet service. Students are also admitting to feeling of anxiety and lack of security with the ongoing pandemic, which is affecting their mental health. Online learning also gives back impact on students' social relationship. Social relationship include the interaction which bind people together. Because of the pandemic, student social relationships are broken. They are unable to read each other's facial expression with their friend and creating communication gap. Now let's move to our research with the next speaker, Alicia Sophia.
Anxiety was prevalent. Sadie and Click 2015 said that anxiety in online learning is defined as a sensation of concern that abuse of information technology will compromise course performances. According to Bollinger and Halupa 2021, the growing number of online courses, mobile device-related anxiety is still a major concern. It has progressed to encompass online learning fears as well as deeper psychological state. So, what had caused this rise of anxiety? As stated by Kelly K 2020, the enormous numbers of activities given by the teachers that must be entirely independent was one of the causes. While according to Hillett J 2020, the dependence of unknown individual, fear of bad evaluation, and anxieties is one of the reasons. As a result, all the factors driving the rise of anxiety among students should be detected as soon as possible. There are two main objectives in our research. The first one is to determine the level of academic anxiety, and second, to identify the factors that contribute to the anxiety. For the methodology, this research adopted a quantitative research design where we conducted a survey via Quizbot. The survey was carried by 200 respondents, which is Form 4 and Form 5 students in Terengganu Fully Residential School. The questionnaire was adapted from MBAZAC and DAF 2021 that consists of three sections, which is demographic, level of anxiety, and factors contributing to the anxiety. Lastly, we use SPSS version 22 for the data analysis. For the result, I'll pass to the next speaker, Nurul Ifah.
Thank you, Alicia Sophia. From the questionnaire that we have conducted, a total of 200 students participated, consist of 110 Form 4 students and 90 students of Form 5. This is the diagram for the level of anxiety based on our questionnaire. Table 1.3 shows that the respondents' anxiety levels were high compared to the data in Table 1.2, which showed a mean of 3.9 and a standard deviation of 0.45. When referring to Table 1.3, the mean level of anxiety is high, with a range of 3.41 to 4.2. Next, Table 1.4 indicates the amount of anxiety as well as the elements that contribute to anxiety. According to the data, with a mean value of 3.63 and a standard deviation of 0.68, the attitude factor was shown to be the most significant cause to the respondents' worry. The factor of distraction comes next, with a mean of 3.62 and a standard deviation of 0.69. Furthermore, we discovered that technology skill was the least important factor contributing to respondents' anxiety, with a score of 2.73 and a standard deviation of 0.55. This can be seen on the graph in the next slide. This is the graph on factors contributing to anxiety. Now, continuing to Ama Afiq on discussion.
According to the data, factor attitude has a crucial role in anxiety among Terengganu fully residential school students. The survey revealed that respondents displayed a variety of attitudes that contributed to their worry. The respondents, for example, stated that they have difficulty waking up in the morning as a result of staying up late, playing video games, or checking social media. They were also bored and uninterested in enrolling in online classes. Their misunderstanding of online learning was another negative attitude they had, as did their lack of punctuality, which caused them to be late for class. We would want to recommend to school officials, teachers, and parents that they take serious measures to ensure that pupils are responsible for themselves and attend the online class successfully. For example, targeted legislative initiatives could aim to reduce the burden on parents while also aiding teachers and schools in making the most of online learning. School counselors can also help these pupils by holding sessions with them and advising them on how to improve their attitudes. Distraction is another issue that contributes to pupils' nervousness. The respondents surrounding and their strong interest in social media were revealed to be the most important distractions in this study. They also claimed that the distraction was caused by quarreling family members, the fact that they had to share the gadget with family members, and the fact that they had an internet connection difficulty. According to the respondents, their concentration on online learning was diverted, resulting in anxiety over not being able to perform at their best in class. So, what are our options for dealing with this? Because the distractions discussed include both internal and external distractions, we recommend that the school hold numerous meetings with targeted students and parents to learn about their problems at home, as well as possibly holding sessions with school counselors to get to the root of the problem. School officials can collaborate with the Parent-Teacher Association to discover strategies to assist these youngsters with issues such as not having enough gadgets to share among siblings and internet connection issues. We continue our slide with conclusion presented by Nurul Irfan.
Thank you, Amafi. We can conclude from this study that two key variables contributing to anxiety among students at Terengganu's fully residential schools were their attitude and the distractions they had to deal with. However, because this study did not focus on the family socioeconomic position, we urge that more research be done on this area so that we can identify the issues and work together to solve them. Hopefully, the findings of this study will assist government and school officials in expanding this research to other schools in order to obtain more information on the level of anxiety among children before developing measures to promote online learning at school while reducing anxiety. Finally, we need to take a drastic action so that students are able to battle anxiety within them and become better students as a whole. Okay, these are the references that we used in our study. That's all from us. Thank you.
What a brilliant presentation. To continue on, we will proceed with the question and answer session. I would like to invite the audience to ask any question regarding the presentation. So here is the first question from user Nasha Irdina. Therapies these days are expensive, and during the pandemic, many people struggle financially. What do you think the government could do if parents could not afford a therapist or doctor? Can our presenters kindly address this question?
Thank you for the question. I will take this question. If the parents are not afford to to go for the expensive therapy. So we can collaborate with the Parent Teachers Association to fund a race for these students to afford um, the fee for the therapies.
Thank you for
Uh,
the answer. So do we have more questions from the audience? The second question is from Zahira Muzamir. Do you think counseling programs really help the students overcome anxiety and depression?
I will take this question again. For me, it's yes because teachers should not be judgmental. So they have to make a meeting with the students that facing anxiety to get to the root of the problem. So they know what actually the students are facing problems. So if they had a meeting, I think it will solve the problems. So the teachers knows what is the actually students' problems.
Thank you for the response. Okay, Azmina.
To continue on, and any comments, any questions from our judges?
Yeah, Assalamualaikum. Very good afternoon. Congratulations for very good presentation. My question is, how does social media and gaming affect mental health and school performances?
Can you repeat again the question?
How does social media and gaming affect mental health and school performance?
Okay. Actually, social media and gaming will affect the students' performance because it makes the student adaptive. Whenever they had class, they will play games or checking social media. So they will not perform at their best in during online class. So they are worried they can't perform well in exam. So it will make them anxiety about their results, bad results.
Thank you.
Thank you for the answer. Now, does Mr. Farhan would like to add any comments or pose any more questions for the presenters?
Okay, good evening, and congratulations for a very apt and great presentation. So, just a quick question for any of the presenters available here. Since you have done this research, what do you think have changed within you in a personal level to help to help reduce the mental health or mental illness problem that is prevalent within amongst your friends?
Sorry, I can't hear your question clearly.
Oh, I mean, what is your role in addressing the issue as a teenager or a student to help reduce mental illness problems within your friends, amongst your friends?
For me, I would give them support and help them with lessons or making a group sessions. I mean, making a group work. If we were given a task from the teacher, I would invite them to make a group work to make the work with discussions. So I think for them who doesn't know to answer or who out of idea of the subjects, so they can know they can know how to do it.
Okay, thank you very much.
Thank you for your feedback, and the time for the question and answer session is up. So, Mafuza, would you like to wrap up?
Okay, those were such excellent explanation. Thank you to the judges and team from Sekolah Menengah Sains Sultan Mahmud. Continuing with the event, let us have Sekolah Menengah Sains Pokok Sena to present their findings with the title COVID-19 Curse and Blessings. Let us welcome Muhammad Alif bin Muhammad Zahari and Amal Sofia binti Abdul Halim. You may begin.
Experience of COVID-19 pandemic in the world from chaos happened all over the world, and this resulted in millions, if not more, losing their jobs and employed. This results in an overall decrease in mental state of people all over the world. One of the most prominent problems faced by many people is an increase in anxiety levels. This may be caused by the loss of income or uncertainty about the future. Thus, our research is regarding the effects of the COVID-19 pandemic on stress and anxiety of demographics. We have chosen this topic because we have been made aware of the deterioration in the mental state of the general populace, particularly those in the education sector. For example, two UITM students have died due to extreme stress and anxiety, Rueda Matzain, 2021. A news article also mentioned an increased suicide cases and calls to suicide helplines across the country due to financial and family problems. Hassan, 2021. This leads us to do more research regarding the effect of the COVID-19 pandemic on mental health of demographic. Hence, the objective of our research is to find out the effect of the COVID-19 pandemic on the psyche of the demographic.
Assalamualaikum warahmatullahi wabarakatuh and greetings. My name is Muhammad Alif bin Muhammad Zahari, and today I'll be taking over from Luqmanul as the presenter of this section. And in this section, I'll explain to you first the operational definition of our subject matter, which is anxiety, and the second one is the review of studies that we have done in order to gather data for our research. Alright, so we based our definition of anxiety on two sources. The first of which is a study conducted by Erwin G. Saracen and his associates, in which they describe the model definition of anxiety as, and I quote, an unpleasant emotional state or condition which is marked by apprehension. We also looked at Charles D. Spielberger's book, in which he described anxiety as an unpleasant emotional state or condition which is characterized by strong feelings of tension, apprehension, and worry, and arousal or activation of the autonomic nervous system. Alright, so with the definition out of the way, I'll proceed with the literatures. The first study that we reviewed is a study done by the APA, or the American Psychiatric Association. And in the study, they have found out that 48% of all Americans are concerned about getting or contracting the COVID-19 virus, while 40% are concerned with becoming severely ill or dying from the virus, and 62% are concerned about their families and friends contracting the virus. The sample size is about 126,000 people, and the method in which they use to gather data is through polls. And the second study that we have reviewed is a study conducted by Muhammad Faris Iman Leong bin Abdullah and his associates, in which they have discovered that about 23.9% of all Malaysians suffer from depression, while 41.7% shows signs of anxiety, and 19.9% exhibited both depression and comorbid anxiety symptoms. The sample size is about 326 people, and the research is conducted through questionnaire. And research, the third study that we have reviewed is a study conducted by P. Highland in the Republic of Ireland, in which that the researchers have found out that about 20% of all Irish people exhibited symptoms of anxiety, while 22.8% reported symptoms of depression, and 27.7% of all Irish people reported symptoms of both anxiety and depression. P. Highland and his colleagues utilized the method of collecting self-reports with a sample size of about 280 people. Now we'll move on to my colleague, Amal Sofia binti Abdul Halim, to explain our findings. Thank you.
Thank you, Alif. Hi, I'm Amal, and I will present to you the findings of our research. We have also carried out our own research regarding this subject matter. The following data sets have many similarities, but they have enough differences to warrant separate description for each chart. As you can see here, 60% of our respondents are females, while the rest are males. The majority of our respondents are students at 65.6%. The second highest demographic presented in our research is teacher at 21.5%. Only 5.6% of our sample is from parent demographic, while 7.3% are of an unspecified demographic, such as employees. In the first item of our questionnaire, the majority of our respondents, which is 47.2%, only feel restless sometimes, while 45.6% experience little to no restlessness. Only a small percentage of our respondents, which is 7.2%, experience constant restlessness. This indicates that a small percentage of people might have great concern regarding the current pandemic, as it might have directly affected their lives. In the next item of our questionnaire, 39.5% of our respondents reported that they easily annoyed sometimes, while 31.3% reported that they rarely feel annoyed. A surprising 90% of respondents reported constant feeling annoyed, while only 10.2% say that they experience no annoyance at all. The result from this item indicates a deterioration in respondents' overall mental state, which might cause them to feel annoyed rather easily. In the third item, 43 of our respondents reported that they feel nervous sometimes, while 30.8% seldom feel nervous, and close to 50% reported that they never feel nervous. 11.3% of respondents have reported constant feeling of nervousness. This item shows that our respondents experience concern, possibly regarding the immediate future. In the next item, 84.6% of our respondents reported that they can still cope with their anxiety, while 8.2% have reported that they are only able to cope sometimes. A small percentage, which is 7.2%, have reported that they are unable to cope with their anxiety. As mentioned before, this points to a lack of reliable and consistent coping mechanism for some people. This item indicates that a staggering 76.4% of our respondents bear some sort of anxiety regarding the future, while 16.4% reported that they do not feel anxious at all. 7.2% of our respondents reported feeling anxious sometimes. With the state that the world is in, it is not hard to see the reasoning behind this feeling of anxiety. In the next item, 84.6% of our respondents reported that they can still cope with their anxiety, while 8.2% have reported that they are only able to cope sometimes. A small percentage, which is 7.2%, have reported that they are unable to cope with their anxiety. As mentioned before, this points to a lack of reliable and consistent coping mechanism for some people. This item indicates that 54.9% of our respondents feel safe about their surroundings, while 31.8% feel otherwise. 8.2% of respondents reported that they only feel safe sometimes, while 5.1% are unsure. This may have some correlation with our respondents' feeling of anxiety. This next item in our questionnaire showed that 45.1% of our respondents share the problem with others, while 11.3% of our respondents only tell about their problems to others sometimes. A surprising 43.6% of our respondents have reported that they have never told anyone about their problems. This might indicate an underlying trust issue in oneself. This item indicates that only 2.6% of our respondents have met a doctor regarding their mental health, while the rest have not. This might have some degrees of significant effect with the previous dataset. The sample size that we use in our research is 195. We have utilized a questionnaire to gather information regarding the issue that we are researching.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Isyadana binti Waizi. I will be taking over the previous presenter to present to you about the discussion of our research. From the data that we have collected, we can confidently reach the conclusion of our research. Based on the data obtained from our literature review, the COVID-19 pandemic has undeniably affected the mental health of people worldwide in a significant manner. The loss of income, sedentary lifestyle, and loss of freedom because of COVID-19 pandemic have caused a significant increase in cases of anxiety, depression, and even suicide. As mentioned before, a deterioration in the mental states of people from USA, Candy 2020, Ireland, P. Handy 2020, and even Malaysia, Muhammad Faris Iman Liang bin Abdullah 2021 has been apparent based on the result of these researches. We also found out that anxiety can increase one likelihood of committing suicide, Hassan 2021. And it is also related to an increase in cases of depression, P. Highland 2020. However, our findings indicate a milder variety of effect from anxiety. We have isolated three aspects that might be the main causes of concern for our respondents. The first aspect is personal stability. Some employees are anxious about drastic changes that may happen at their workplace. To help alleviate this problem, we suggest setting a daily routine. A routine might help someone to retain a sense of consistency in their life, which might help in a world full of turmoil and sudden, unexpected changes. A routine might also help someone retain a semblance of control in their life, which might help them preserve their mental health. This method might also work to cope with financial instability. In these trying times, many people got laid from their jobs. Thus, being in a state of financial instability is a reality for most people. Other than having a routine, people can also turn to initiatives such as online business, which can help them keep a somewhat stable source of income. Students also face anxiety during these times. Online classes have put a great amount of stress on students, and some students feel worried that they might not meet their parents' expectation. This problem can be alleviated by consulting a counselor or trusted acquaintance. Based on our research, some students also exhibit some form of trust issues. To help alleviate these problems, we have also made a website in which students can vent their frustrations, and we will offer some solutions to them. This might help the students re-evaluate their concerns and preserve their mental health. After all, online consultations is the way to go considering that the pandemic severely limits one's ability to directly meet up with a therapist. Issues about health is also a great concern for many people nowadays. Some have elderly parents who live far from them, so they might not be able to check on their conditions all the time. We suggest that they keep in touch with their friends and family through social media so that they at least have some closure regarding any issues that their loved one might face. We do hope that the solutions that we suggest might help at least some people to overcome their problems. That is all. Thank you. This is the list of reference that we use in our research. That is all from us. Thank you.
Such a fascinating presentation from Sekolah Menengah Sains Pokok Senen. It is time for the question and answer session. The chat box is welcome for any sort of inquiries from the audience.
First of all, from user Kride Sharma, the question is, what according to you is the best innovation in the field of mental health management with emphasis on the ongoing pandemic? Any thoughts from the presenters?
May I answer the question?
Sure.
All right. So, in my opinion, I think one of the best innovations in the field of mental health management with emphasis on the ongoing pandemic is online consultations. Because, well, with the pandemic, as we have said in our video, face-to-face consultations aren't exactly practical because fears regarding the virus and SOP regulations. So I believe that online consultations can help some people deal with the problems by talking with a psychiatrist or other qualified mental health personnel.
Thank you very much for the response. Do we have any more questions from the audience? So here's the second question from user Hannah Muazzam. What are your solutions for people that are unable to voice out their problems?
May I answer this question? Okay, for me, solution for people that are unable to voice out their problems. Actually, we have create innovation that's called China Care website. This is focused for China students actually. This website is focused on for students that face trust issue to voice out their problems. Here, I want to emphasize the use, how to use the website and the advantage of it. Okay, so students need to click the link that we have provided on our Instagram, official Instagram, to access the link. And then after they reach to the website, they need to scroll down until they found the discussion section. And lastly, they can comment their problems, share the problems, or can comment to others user there. So let's move to the advantage of using this website. Um, Students there can share everything about their problems without worry because we have said because nobody knows their identities, and also they can give some suggestion to their friends to overcome their problems. I think that's all. That is our innovation. At least it can help our students, our friends, to voice out their problems and vent their frustration. Yeah, thank you.
Thank you for the lengthy answer. So, Azmina?
Then, any inquiries or any thoughts from our judges?
Assalamualaikum and good afternoon. Okay, congratulations for a good presentation. My question is, in your opinion, how can parents help prevent or reduce anxiety among adolescents?
May I answer the question? All right. So, in my opinion, I think that a good way for parents to prevent their children from having anxiety problems is by being a good listener. Because for me, I think being a good listener is a good way to help someone who has concerns or worries regarding the far future or even the immediate future. So I believe one thing that parents can do is being a good listener to the child and listening to all their problems. It might also help if they consistently check up on their child's mental states by asking them sometimes. And another things that parents can also do is by referring their children to psychiatrists or other qualified mental health personnel. to express their problems.
I do
Thank you.
agree with your opinion. Mafuza, do we still have more time?
Yes, we have another 1 minute.
Then would Mr. Farhan like to give any more comments or any questions for our presenters?
Okay, congratulations. Thank you very much for giving a very great presentation. Since we only have 1 minute, I'm just going to be giving you a light comments. First of all, do not be afraid of using visual aids because that's going to be very helpful in conveying whatever it is that you are trying to say. Because sometimes words are mumbled and hidden beneath breath, so it's important for you to actually have one or two things behind on the screens. And on the second part, I would really love it if we could have just gotten a sneak peek at the things that you have just mentioned. Ahmad Sofia, the programs, the website that you guys use, that would have been great. Thank you very much.
That concludes the question and answer session. Thank you again to Alif and Amal Sofia. Yes, Mafuza.
Oh, I was just thinking that throughout today's session, we have watched so many fascinating research presentations.
Really? Me too.
Well, enough about my thoughts.
Carrying on with the symposium, let's give a warm welcome to Team St. Mark's Girls Senior Secondary Public School, Mitabah India from Team 3, with the presenters Sakshi Shokin and Vanshita Bandari. And let's continue watching their research presentation with the title Healthcare Innovations and Mental Health Anxiety Management During the Pandemic. Please welcome. It seems like we are experiencing some technical glitches right now. So are you ready for the questions later on? Are you nervous perhaps?
Indeed, we are a bit.
I'm sure you will do just fine later. So what time is it in India actually?
It's 12:29 right now.
Wow, it's quite early. Like not really early, but like not like Malaysia is 3 right now. So have you eaten?
Yeah, we did our breakfast.
Okay, so it seems like the technical problems are restored. So let's now watch the video presentation.
Hello everyone, I'm Vanshita Bandari of grade 11th.
Hello everyone, I'm Shreya Silhotra of class 9th.
Hello everyone, my name is Sakshi Shokin and I am in grade 10.
Hello everyone, I'm Vedika Kapoor of class 10 and we are the students of St. Mark's Senior Secondary Public School, India.
Our methodology was a qualitative research. Lot of surveys were conducted and interviews were done. We got to know that new innovations like telecounseling and new apps were introduced in the market.
Mental health problems are still considered a social taboo. COVID-19 has had a lasting effect on everyone's mental health. Many renowned personalities have shared their mental issues during this period.
The impact of COVID-19. pandemic has placed unparalleled demands on the modern healthcare system. The industry's response has vividly demonstrated its resilience and ability to bring innovations to the market quickly. But the crisis is far from over, and the industry's innovation capabilities must continue to rise to the challenges presented by COVID 19. Notably, emotionally driven sharing of misinformation has featured prominently in this crisis, fueling both confusion and irrational anxiety among the public. This has far reaching health consequences with a direct impact on overloaded healthcare systems and an indirect impact on the mental health of public. Telemedicine and teletherapy were adopted. Demand for mental health increased drastically, which resulted in disrupted services. Movements and social interactions were restricted. The people were scared, stressed, and feared.
Survey results. When we question people in the survey that has their child talk to them about his or her mental state, then around 43% people agreed, whereas 34% people disagreed with the same. When we question teenagers that how often have they been bothered by feeling down, hopeless or depressed, then around 60% of them replied that they feel depressed most of the time. When the doctors were questioned that has COVID-19 resulted in innovations in healthcare, then about 82% of them agreed with it, whereas 18% of doctors are unsure about it.
Now let's have a look at the interviews we conducted.
Now, next question I would like to ask is that were there any healthcare innovations for mental health anxiety management during the pandemic?
See, I would not exactly call it an innovation, but what has happened because of the pandemic is that the acceptance of telecounseling and teleconsultation has gone up really.
Do you think these innovations are serving their purpose in keeping people safe?
Yes, definitely these innovations are necessary. All these innovations are vital to our growth. Medicine is always constant, always constant research. So without all this research, we will not be able to progress and understand newer therapies and understand the changing. The virus is changing, so we are also supposed to change.
My next question would be that do you suggest medications to only serious cases or try to treat other patients with some exercises like meditation, etc.? And how does that go about?
Well, we give non-pharmacological treatments in simple cases, and not that in severe cases. In severe cases, we give medications only. But before we give any medicine, we keep a check on the number of times they visit us and how severe the case is.
Ma'am, how did your mindset change after recovering from this deadly virus?
बहुत ट्रबल में रही मैं ड्यूरिंग द डेज प्रॉब्लम काफ़ी मेरे को डीपली रही और 20 दिन मेरे बहुत बुरे निकले जिससे मेरे को फैमिली की बड़ी सपोर्ट रही मेरे को और फॉर्चुनेटली गॉड मेरे पे ब्लेस्ड थे तो मेरा इलाज जो सा घर पे ही हो पाया मैं हॉस्पिटल जाने की नौबत नहीं आई बहुत अच्छे डॉक्टर मेरे को यहाँ गुड़गांव में मिल गए थे उन्होंने बहुत अच्छा ट्रीटमेंट किया बड़ी अच्छी नर्स जिसने मेरी लुक आफ्टर की पर मैं रात को सो नहीं पाती थी बड़ी प्रॉब्लम में रहती थी यही सोचती थी कि कब क्या बाहर निकल पाऊंगी अकेले रहने में बड़ा डिप्रेशन सा था बिल्कुल चाहे अपने घर में भी थी मैं बट ठीक है भगवान ने मेरे वो दिन निकाले और थैंक गॉड कि मैं ठीक हो गई सबकी विशेष से और रूम से बाहर आई बट हेल्थ में मेरा बहुत असर हुआ उस चीज़ का उसके बाद से मुझको सिर्फ यही है कि हेल्थ कुछ भी हो हेल्थ अच्छी रहनी चाहिए आदमी की इम्यूनिटी स्ट्रांग होनी चाहिए किसी भी चीज़ के लिए हेल्थ है तो सब कुछ है
A few interviews were conducted to study a topic more profoundly and practically. A school counselor was interviewed to comprehend the mental well-being and anxiety of students during this period. The psychiatrist said that prescriptions were given to serious cases only. A vast majority of individuals had suicidal thoughts. Crisis intervention and telepsychiatry were provided to them. The patient who was interviewed said coronavirus was consistent pressure for her. Since she had already been vaccinated, the seriousness of disease was quite low. She advises individuals to take medications prescribed by specialists and keep a positive mental attitude for a speedy recovery. For healthcare innovations, many specialists were interviewed. They said that resources were near exhaustion. As far as innovations are concerned, a lot of research was done. A major breakthrough was made when vaccines were made available for general public. The virus might turn into a seasonal disease, and it might keep mutating. But as it does, so do we.
Now presenting the case studies. The teenager noticed changes in herself like feeling suffocated, facing a difficulty in breathing, and at last discovering being an introvert. Socializing felt like climbing a mountain. Being constantly pressurized by schoolwork, her heart rate used to increase. No medications were taken by her. Neither did she consult a specialist. To distract herself, she started creating fantasies. The idea of sharing her feelings with her parents made her think that they might not understand her, but once she did, she realized that she felt lighter and better. The adult too felt suffocated, anxious, and didn't consult anyone. She also became a cleanliness freak as she was worried about her family contracting the virus. She sanitized everything constantly and stopped going out. Making her family members change clothes, take hot showers, and sanitizing them whenever they came back to the house became a daily routine for her. Other behavioral changes were anger issues and loss of appetite. Fortunately, her case became stable when she started talking to her best friend and stepping out again. The adult and the teenager both felt suffocated and anxious. While the teenager was pressurized because of schoolwork, the adult felt anxious because she was afraid that a family might get infected. They both stopped socializing. Neither of them felt any need to consult a specialist, and both of them felt lighter after talking to people who they loved and expressing themselves. This shows that this period has inflicted numerous changes on people, which have made them stressed and anxious.
Conclusions. Mental illnesses are still considered a social taboo. The professionals interviewed suggested that we still need to be vigilant all times. Majority of medical personnel state that there have been numerous innovations in the field of healthcare. These innovations are considered to be permanent. Although many people suffer from various mental health problems, majority of them have not found them serious enough to consult a specialist.
Wow, I'm astounded by the great research presentation.
Before we begin the question and answer, I would like to reintroduce this team. Let's give a warm welcome to Team St. Mark's Senior Secondary Public School Mirabah, India from Team 3 with the presenters Sakshi Shokin and Vanshita Badarin.
Now we will commence with the question and answer section. User Aspiring Girl has a question about I saw many healthcare innovations take place during the pandemic. As you research and might be knowing more, could you please state more healthcare innovations you learned from this report? Would our presenters kindly address this question?
Thank you for asking this question. I would like to answer this. See, there were many healthcare innovations introduced in this pandemic, like vaccines, and there were many apps introduced by the government and the provincial government as well. And apart from that, there were some websites introduced because finding a bed was really difficult job because everyone was suffering from COVID, and they beds were really vacant. Wasn't vacant, so they were telling us where we could find beds, and there were many more healthcare innovations.
Okay, thank you for the answer. Do we have any more question? The second question is from user Hannah Muazzam. Were there any actions that were taken by the government in India to help with the people's mental health? If they are not, what do you think they should do to help, or do you have any more suggestions?
Thank you for the question. I would like to take it. I am not very much sure about the steps taken by government to help the mental health, but there were a lot of workshops and surveys being conducted in our schools, which helped the students to be more profound and more discuss about the mental health and the things that they're going through during the pandemic. So I feel like it was very helpful.
Thank you very much for the great feedback.
Then, any more questions from our judges?
Hello, everyone. Congratulations for a very good presentation. My question is, telecounseling was mentioned as one of the health innovations in this COVID era. What are the challenges that you can foresee in implementation of telecounseling?
Thank you for the question, ma'am. Telecounseling is basically professional counseling via an online platform. And indeed, people will feel many challenges as they go for telecounseling because it's not the same as offline counseling. But the counselors are working hard to so that they can help the people who are going through mental illnesses, and more things like crisis intervention, which helps in reviving someone's trauma from a crisis, in our case which is COVID-19, and telepsychiatry, which is the same psychological therapy using a online platform is there, so it helps a lot.
I would like to add to this point that in this crisis, when there were no other options, though telecounseling is not good as physical counseling, but it definitely helped a lot.
Very good. Thank you.
Thank you for your feedbacks. Then, does Mr. Farhan would like to add on any other questions for the presenters?
Okay, congratulations on such a brilliant presentation. My question to you is, as you have mentioned before, mental health issues or illness is also considered taboo here. So, what do you think your role as students and teenagers that you can do to help alleviate or to help minimize this stigma in your school amongst children? Thank you.
Thank you for the question. I would like to answer that. Since mental health is a social taboo in our society and it's a really sensitive topic, so as a student, we can talk to our counselor because she knows a lot about it, and then we can organize some workshops about it, and then aware our friends also.
I would like to add on. We were lucky enough to consult various professionals like school counselors so that we could get a proper opinion about her, that how she copes up with the students who are facing mental illnesses, and we were also able to consult many professionals. So I feel the surveys that were conducted and the case studies that were done may help a lot to pros upon this topic.
Brilliant. Thank you.
Thank you for your response. Do we still have time, Mahfuza?
I'm sorry, but I think the time is up.
Wait, Mahfuza, before we end, I would like to say that I am very sorry for mispronouncing your school name early on. So then we can wrap up.
It's fine.
Thank you to the judges and the presenters. Well, let's now hear from the next team, Sekolah Menengah Sains Muar by Intan Suraya binti Muhammad Khair and Nur Alisa Fazrin binti Muhammad Hazi to proceed with their presentations with their title, Lockdown Causes Distressing Towards Malaysians. The floor is yours.
pandemic has caused any delay going on in a lockdown, and Malaysia is not an exception. It's obvious that this pandemic has brought a lot of changes in our lives, and that is where this program started. Assalamualaikum and good day. We, Samurai Angels, with the help of Saizat bin Zainal, has conducted a research on the topic Lockdown Causes Distress Towards Malaysians.
Hi, my name is Faika Azwani. My name is Mir Alisa Fazrin.
Hi, I am Intan Suraya.
And hi, my name is Aisyah Khalida binti Muhammad Azila.
Ladies and gentlemen, hi. I am Aisyah Khalida. As the first presenter of my team today, I will be explaining the meaning of our sub-theme, Healthcare Innovations and Mental Health Anxiety Management. First of all, what is healthcare innovation? It's important to note that innovations are not only limited to technologies. Well, according to World Health Innovation Group by WHO, healthcare innovations are developments and improvements on health policies, systems, products, technologies, and health services. What about mental health anxiety? Mental health is the condition of someone's mind and whether or not they are suffering from any inner illness, while anxiety is an uncomfortable feeling of nervousness and worry about something that's happening or about to happen. The keyword of our sub-theme is management. The management we are talking here is the process of dealing with or controlling something. Ladies and gentlemen, it's true. Anxiety is not so rare to hear nowadays. Unfortunately, the numbers had skyrocketed during this pandemic. Clearly, this pandemic has affected almost everyone in so many ways, either physically or mentally. From the way of living, our social life, work or school, and the connection we had with everyone, almost everything has changed, and the anxiety that was caused by this pandemic has bring people to hurting themselves or even taking their lives. But now, let me pass the screen to my friend Intan Suraya and let her dive deeper about the problems we are talking here.
Hi everyone! Passing on, it is obvious that the COVID-19 pandemic has had a major effect on our lives. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in human regardless of age. And on my right, this is a funding funded by NLM, which is National Library of Medicine, which determined that people are struggling with stress, anxiety, and depression during this lockdown. Well, many of you must be wondering, why is this happening? Well, according to the Straits Times Malaysia, it is stated that family problems, emotional pressure, and finances are the main cause of this problem. Relating to our survey via Google Form, also that means that 18.7% of the targeted group of study has had finances problem in this global pandemic. And connecting with others is more important than you think. Our survey has ascertained that 54.2% had problems with the people around them. How can this affect mental health? Well, social connections can help us regulate our emotion because it can decrease our stress and anxiety and help us improve our immune system. By neglecting our need to connect, we put our health at risk. And the reality of WFH is disconnections. While technology seems to connect us more than ever, the screens around us disconnect us from the nature, from ourselves, and from others. Furthermore, we have done few researches on the local legal newspapers, such as the New Straits Times, that they stated there that the suicide cases has risen due to the nationwide lockdown. Also, adding on, Dr. Nur Hisham Abdullah has also stated that in the first quarter of 2021, the suicide cases has reported on average 4 cases daily. The New Straits Times Malaysia has also found out that Malaysian students' stress level went up during MCO. Not going to life involving in online learning could be very stressful due to the low speed Wi-Fi and other interruptions. Sometimes we are burned out from the online classes because we have no time for ourselves. But I would like to say that it is okay to not be okay. And it is natural to feel stress, worry, anxiety, and grief during this global pandemic. We have to bear with it and fight until we win. Thank you, and I'll pass my speech to Alisa.
So, as everyone just listened to Intan Suraya's presentation about the problems, I am Nur Alisa Fazir binti Muhammad Haizan Nasution is here to go for the solutions of the problems we face these days. Firstly, we are going to talk about prescription video games. Why do we choose video games? Well, during lockdown, people are staying at home and most of us are having free time after class or work from home for students and adults. We have to admit that these days, games are indeed our daily routine for people regardless of ages, starting from kids, teenagers, and even adults. So, we have invented applications that can help people to release their stress. Please note that this way is invented to prevent and not to cure. So, how? We will insert posters or ads about the importance of taking care of mental health, especially during this pandemic. Why do we think it is effective? Because it is a game. Game is an attraction that many found fun and interesting. Whenever the posters or ads pop up, it will get people's attention to read and acknowledge themselves even during playing games. As an example, when someone said, he or she will remember the ads they read on how to overcome their sadness or problems. Let's move to the second way, which is AI and smartphone assisted therapy. This feature will use a microphone and speaker with the help of AI chatbots. But how does this work? AI chatbots can recognize and analyze patients' voice and speech patterns. So, you will have to download the apps and activate it. Then, the system will read your voice and will notify the psychiatrist if there are any emotional distress just through your voice. Well, most of us will raise our voice whenever we feel mad or stressed, right? So, that's how it works. Last but not least, we invented the platform track users' moods on internet, a technology designed to measure users' mood while online through camera and notify them if particular websites are triggering their stress hormones. It can also detect whether the websites they visited is having positive or negative contents that can impact their moods. Then, the system will send the data to our psychiatrist, and if the condition is bad, a psychiatrist will be hired for a moment with you. So, not going to lie that AI and chatbots are going to affect your privacy, but in this case, we have to prioritize ourselves first. That's all from me, and I will pass the screen to my friend Faika Hazani to conclude the topics we are talking about today.
That brings me, Faika Hazan binti Syamuddin, to the end of our presentation. To summarize the main point of this presentation, it is so important for us to practice ways on how to control and manage our anxiety during this pandemic, which we know is a very hard time for all. Everyone are too busy with their studies and work until they forget to care about their mental health. Anxiety is a common emotion when dealing with daily stresses and problems, but when these emotions are persistent, excessive, and irrational, anxiety becomes a disorder. Anxiety can also become the cause of tremendous suffering for millions of people in this world. Hence, we need to take an action to prevent and reduce anxiety. The prescription video games that we invent can help mostly all people in Malaysia, as most of them are playing video games regardless of age. Next, the AI smartphone assisted therapy can reduce the number of suicidal, as it can detect our mental level and notify us if there is a sudden change in the level. Last but not least, moving on to our platform track users mode on internet, which can measure users mode while online and provide a therapy session with the psychiatrist if the condition is getting worse. If it is not clear enough at this point, I would say that all of our inventions will really make a change for Malaysia in the future and reduce the number of anxiety patients. I would like to take this opportunity to remind all of the students, workers, and indeed everyone who are suffering with anxiety at the moment to take a break and know that you are enough no matter what you are facing. Don't be too hard on yourself and know that even a small step that you take, it is still a progression. And finally, with that, I would like to end our presentation with this inspiring quote from Martin Luther King Jr., which says, if you can fly, then run. If you can run, then walk. If you can walk, then crawl. But by all means, keep moving. Thank you so much for your interest and attention. That's all from me and my friends from Sekolah Menengah Sains Mall.
What a really fascinating presentation from Sekolah Menengah Sains Muar.
I'm sorry, but let me reintroduce the presenters. They are Intan Suraya binti Muhammad Khay and Faika Hazwani binti Hishamuddin.
Now let's continue with the question and answer session. Any sort of inquiries are welcomed in the chat box.
First of all, user Amirul Haziq has an inquiry about how can social connections help to improve immune system. Any thoughts from the presenters?
Well, let me answer this one. Well, basically, social connection is a connection between people and people with people, meaning an interaction between a living human and a living human. Well, what makes us happy? Well, have you ever heard people saying that money is not everything? Well, yes, because happiness doesn't come from money. Happiness comes from the people around you, from the environment, from the people, from even your sisters, maybe from even your friends, your families. And it improves immune system because if you don't connect with people, you will feel stressed. You will feel not enlightened. You don't feel bright when it's any day. With social connection, it can help many. It has many benefits, including improved immune system, because it is obviously the interaction between human to human. It brings happiness. That's my answer. Thank you.
Thank you for the great feedback. Do we have any more questions from the audience? So I think we can proceed, Azmina.
Then does our judges would like to pose any questions for our presenters?
Assalamualaikum. Hello, Samurai Angels. Okay. Congratulations for a very good presentation. Okay, my question, yeah. Many students voiced out their frustrations and challenges in online learning. So in your opinion, how can teachers make online learning interesting, exciting, and enjoyable?
Okay, let me ask the question. Let me answer the question. Thank you. So teachers can reduce the anxiety of reduce the stress of the students by making online quizzes such as quizzes and also something interesting, and also make the presentation of the learning more attractive so that the students can learn about them easily and fun, so that they will not bored in the class and will not sleep, of course. And other than that, the teachers also can decrease the number of homeworks that they give to the students so that they will not feel the pressure of themselves. Okay, thank you. That's all of my answer.
Thank you for your intriguing insight. Then Mr. Fahan would like to add on any questions for our presenters.
Okay. Good evening, ladies. Very good presentation. Um, my question is going to be with regards to some of or several of your solutions. Some of your solutions suggest the usage of digital media. Now, do you believe or do you think that more exposure to screen time for students is good or bad with regards to your solutions?
Any thoughts from our presenters?
I will answer the question. Thank you, Mr. Farhan. And I think the exposure to the screen too long can make us feel stressed, and it can increase our anxiety because as we are in the pandemic, we did not have anyone to talk to, and staying a long time in front of your laptop or maybe your mobile phone can make you feel pressure and increase your stress. Okay, that's all from my answer.
Thank you for your response. And as the time is already up, this concludes the end of our question and answer session. Well, Mahfuza, do you know what last but certainly not least means?
Of course, I use that phrase in all of my essays. It means that people who come last in a presentation or in an activity does not mean they are any less than the ones before.
So true.
Why are you asking, however?
Because our next group is the 17th and last group for our session today.
Really?
Without further ado, I now give the floor to Fatma Nur, Merdilsi Zoglu, and Zainab Erdogan from Besiktas Sakit Sabanci Anadolu Lisesi, Turkey, from Team 2 to proceed with their video presentation with the title Healthcare Innovations and Mental Health Anxiety Management During the Pandemic.
Hello everyone, we hope you're all okay. Today me, Zaina Cardoan, and my friend Husnia Ardam are going to present to you our presentation, which was prepared by our team as me, Zaina Cardoan, Husnia Ardam, Merve Dilsizoğlu, and Hana Şekeral, named Lemon Cologne. And our supervisor is Ayşe Şule Kılıç. Plus, the presentation is about healthcare innovations and mental health anxiety management during the pandemic. We are from Turkey and we are studying at Sakıp Sabancı Anatolian High School. Our school, which was founded by Sakıp Sabancı, a successful businessman, is located in Beşiktaş, Turkey. In addition, we have the International Baccalaureate Diploma program, which means we are an international school. And also, we have lots of clubs in our school, including the ones in English. Let's go. During controlled social life conditions, HES, which means Life Fits into Home Code, helps you safely share your COVID-19 risk status with institutions and individuals for activities like transportation or visits. Shared HES codes can be checked through the app or services provided to institutions. This code solely serves as a risk mitigant for infection in long-distance transportation vehicles during travel. COVID-19 patients or contacted people will not be able to use public transportation. We use this code to inform you if anyone in the same vehicle is diagnosed as positive. Reasons of anxiety during the pandemic: compulsory isolation from society, feelings of fear, anger, worry, frustration, lack of concentration, lack of sleep, and increase in nightmares. Now, my friend Husniye will tell you more. The floor is yours, Husniye.
Anxiety management for past and current infections. Since COVID-19 was declared an international public health emergency, youth have been exposed to anxiety and devastating damages in their lives. Pandemic mostly affected youth because of the rapid and urgent restrictions. Moreover, those conditions have disruptive pressure on children. Depression and generalized anxiety are two of the most common mental health concerns in youth. Depressive symptoms, which include feelings of sadness, loss of interest, and pleasure in activities, as well as disruption to regulatory functions such as sleep and appetite, could be elevated during the pandemic as a result of social isolation due to school closures and physical distancing requirements. Adults and young adults. Not surprisingly, quarantine has effects on adults regarding to economical, mental, and health issues. They also have anxiety, depression, worry, and frustration. As the pandemic wears on, ongoing and necessary public health measures expose many people experiencing situations linked to poor mental health outcomes, such as isolation and job loss. Young adults have experienced a number of pandemic-related consequences, such as closures of universities and loss of income, that may contribute to poor mental health. Compared to all adults, young adults are more likely to report substance use and suicidal thoughts. Research from prior economic downturns shows that job loss is associated with increased depression, anxiety, distress, and low self-esteem and may lead to higher rates of substance use disorder and suicide. Senior citizens. Older people are at higher risk of suffering negative outcomes, which can lead to an elevated rate of mortality, being 5 times higher than the global average for those older than 80 years old. Naturally, this reveals an appalling fear on elderly people linked to high risks. Elder people are not only physically affected during quarantine, but also mentally. Several studies have described mental health consequences in previous quarantines, such as high risk of depression, emotional disturbance, stress, low mood, irritability, or insomnia being also associated with higher rates of suicide in an elderly population. Because of the inherent result of human growth, senior citizens are not able to socialize as much as the young people. Prior to the pandemic, they were also isolated, and when the orders were implemented, it became really hard to avoid loneliness for elder people. How to cope with anxiety. During the pandemic, people couldn't find any chance to have face-to-face communication, but it's significant for human body and their mental health because it is a humanitarian need that affected people a lot. So we have to talk with people during the quarantine, at least via our phones or social media. That helps us to keep in touch with others and share our thoughts. Regular exercises. During the pandemic, gyms, sports clubs, pools are all closed, so keeping your form is essential. Every day, people must do some exercise. It will also help them to have a clear mind. In this way, they can keep themselves occupied and worry less. Healthy eating. During the quarantine, food companies have increased. People choose to eat fast foods because buying is easier than ever. Only by clicking a button, your meal is ready. Recently, people don't even want to go to markets that are close to their apartments. Easiness brings laziness. So you need to get some fresh food. Prepare your meal and don't forget to drink lots of water during the day. These days, we cannot go outside and breathe fresh air, so it is our responsibility to take care of our bodies. Comfy sleep. Sleeping between particular and regular hours of sleep helps you to experience a comfortable sleep. So you need to avoid napping in order to be tired and sleep easily. If your mind is filled with worry and fear, you can write them down before you go to bed. This helps you to think less and focus on sleeping. These are resources. Thank you for giving your attention to our presentation. Thank you for listening.
Great presentation from this team.
Let me reintroduce our presenters. Our presenters are Zainab Erdogan and Husni.
Now is the time for the question and answer session. The chat box is open to any sort of inquiries from our audience.
I can answer this question. we've been at home too much, and we've all been exposed to stress and anxiety. Because of this, our psychology was badly affected, and we couldn't get the help we needed because of the pandemic conditions, and that's why we did research and found solutions that can help people and get them out of this difficult situation.
Thank you for your interesting response. Are there any more questions? So from user Siti Ashira Ismail, the question reads as, the current vaccinations and steps are not bringing the numbers down. Can we say that these measures are a failure? Your comments, please. Thank you very much.
Can I answer this question?
Sure.
We think that the tests may be wrong and these measures may be a failure, but not only vaccinations can work preventing the COVID-19, so we need to work more on healthcare, and we need to know the rules. We need to do social distancing, and when we see in the streets, people doesn't really care about that, and we need to take some we need to have a knowledge about these situations to bring the numbers down at least a bit. Thank you.
Since there are no more questions from the audience, does our judges have any questions for our presenters?
Hello, girls. Okay, congratulations for your presentation. My question is, what is the role of immediate family members like your parents, your grandparents, or your siblings in preventing and reducing anxiety among adolescents?
I'm sorry, could you please repeat?
Okay, what is the role of immediate family members? For example, parents or your grandparents or your siblings in preventing or reducing anxiety among adolescents?
Okay, I can answer this question if you wish. Thank you, by the way, for your comments. The behavior of parents is very important because, important in the life of young people, there should be a reliable and healthy bond between them. Young people are afraid of the reaction they will face or they will get. I think we can overcome these problems if we improve our attitudes towards them. And as friends, we must talk and share our problems among us. If we tell our problems to each other, we will probably feel better about them.
Thank you.
Thank you for your feedback. And as we still have another minute, any inquiries or any comments from Mr. Farhan?
Okay, thank you very much for the lovely presentation. Just a quick question. One of the suggestions that you guys mentioned was keeping healthy and regularly exercising. And seeing that we both here in Malaysia and also there in Turkey have been self-isolating, what kind of exercises that you would recommend for us to do indoors?
May I answer this question? There are many videos on such platforms as YouTube, and we can do jumping or not running but running at the same place, like in our room, and we can practice breathing exercises, or we can keep our mind busy with thinking, and like not only physical exercises but thinking, and we need to keep our brain busy.
And also meditation, maybe.
Yes.
Okay, very good. Thank you very much.
Thank you for your response.
So the period for the Q&A session is up. I hope the presenters' answer helped clear the air. Thank you to the judges and the presenters from Team Turkey. Thank you to the judges, teachers, participants, and audience present for your undivided attention throughout this last session.
As a last reminder, do fill out the online quiz that is given in the chat box below. The quiz is designated for your e-certificates. The online quiz will be closed tomorrow at 10 a.m. We are really honored to have been your moderators for today. We would like to apologize for any inconvenience we may have caused throughout this program.
Do you know what always makes me sad, Azmina?
What is it, Mahfuza?
An ending to a beautiful event.
Me too, actually.
Well, we have now come to the end of today's presentation. Thank you for following us until the end. Till we meet again, and with that, we thank you.
Bye.
Bye.